Hello, everybody. Welcome back to the Women's Health and Fertility Podcast. This is season 2 of our podcast. And to start off the season, I am so excited to introduce my dear friend and sister in wellness, Leilani Wong Navar. She is a fellow acupuncturist and practices here with us at Revive Chi. She is licensed in acupuncture and Chinese herbal medicine. She's a certified dream worker and functional medicine practitioner. She began her practice in 2012, and she is passionate about women's health through all stages of life and about helping people of all genders address injury recovery, stress management, optimal sleep, and autoimmunity. Leilani grew up in Irvine and studied naturopathic and classical Chinese medicine at NUNM in Portland, Oregon. She studied fertility awareness with Justice College and became a certified holistic reproductive health practitioner in 2010. Her functional medicine training is with Dr. Aviva Ram, a physician and midwife, and before returning to Orange County with her husband and 2 children in 2022, she and her family lived on a permaculture homestead in the high mountain desert of southern Utah. Passionate about deep ecology, Leilani hosts Turning Season podcast and offers community programs that integrate Chinese medicine and the work that reconnects. Well, hello, Leilani. Thank you so much for being on my podcast today. I am so happy that we were finally able to do this. I feel like we've been talking about it for like a year.
Yes.
And I just want to give some background on how we know each other. So was trying to think, I think you joined our practice in 2021. Is that correct?
I think, yeah, well, 2022, actually, yeah.
2022. Okay.
hmm
So it technically has only been like 3 years, but I feel like I've known you forever
Uh-huh.
because
Approximately forever.
yes, and in many lifetimes before. And the way we know one another is through your mom, which of course I've known your mom for 18 years. So I feel like that's why our connection was so instant and it felt like we've known each other for years and years.
Yeah, absolutely.
And it's been such a amazing journey with you and having you join us at Revive Chi. And I am just so grateful to have you as one of our acupuncture team members and all the expertise that you bring to our clinic. But I'd love for you to kind of share about how it all started for you and what led you into this journey of becoming an acupuncturist and a holistic healer. That's
Okay, great.
amazing. Thank
Well,
you.
first of all, thank you, Dr. Yang, for bringing me on the podcast and bringing me into the practice. I feel incredibly fortunate to have connected with you right after moving back to Orange County. You'd been taking good care of my mom as well as some of her friends for a long time. And so, yeah, it was amazing to connect with you right away and be able to step into my dream scenario of practicing with a wonderful team and doing a combination of traditional Chinese medicine with functional medicine and being able to bring in my other modalities like the craniosacral and dreamwork. It's just been incredible to work with you and the wonderful patients who come here. So,
Well, the feeling is mutual, really, Leilani. So,
thank
so
you.
how did it all start for you? Because Chinese medicine, I think, as far as how it was 20 years ago, was still pretty new, I would say. I mean, and it was still kind of seen as complementary medicine or maybe even
Right.
alternative medicine in some states. I feel like California has always been a little bit more progressive.
hmm
So, how did you find your way?
So, actually, my first experience with Chinese medicine was in China when I was 6 years old. I grew up with asthma and allergies pretty much from birth, as far as we can tell, although it wasn't diagnosed right away. And I was treated only with Western medicine in the beginning. But then in Beijing, I used some Chinese herbal medicine as well. So at that time, at age 6, I remember saying to my mom, I want you to save these little bottles of herbs, because they saved my life.
Oh,
And I wasn't, to my knowledge, actually in any mortal danger from an asthma attack or anything, but I had such a strong sense that these herbs mattered that much to me. So there was
well,
that
I love how
connection.
intuitive you were and like you just knew that this was the right medicine for you.
I guess I did, but I sort of forgot about it for a long time after that. I think that I guess not so long, but for some time after that was when I was about 6. And then it was when I was about 16 that I came back around to holistic healing and realized that was something I really wanted to do. So I met a naturopath actually when I was 14, still on a lot of medications for asthma, and had my mind blown by the possibility of addressing health from a deeper level and getting to root causes. And I'd never had any idea that diet could make a difference, that stress was involved, all of those things. And then by 16, I decided that was what I wanted to be when I grew up, was practice at the time naturopathic medicine. But parallel to studying women's health, I studied fertility awareness because I was really excited about that as a form of natural birth control
Mm,
and was lucky enough to learn about it at 18. Started studying to be certified to teach and was moving in through the pre-med requirements for naturopathic school, but I was also training Chinese martial arts and doing martial arts and qigong. My teacher actually was said, "Why aren't you studying acupuncture?" And I
yeah.
said, I don't know. Should I? And then that was the beginning of exploring and visiting different acupuncture schools and eventually leaving behind the naturopathic doctorate program to just
Mm,
focus in on Chinese medicine because I really saw how this is a lifelong path. It's a lifetime of
mm,
study, to master Chinese medicine and to be able to do the personal practices like practicing that qigong and cultivating myself. So I still do a lot of things, probably more than maybe ideal, but I'm a little more focused. Chose to focus on Chinese medicine and now bringing in functional medicine. So I get a lot of what I had hoped to do with naturopathic
mm.
medicine back in our practice now.
That is so cool. I love your background in martial arts. And for those of you that have seen Leilani in our practice, she is a phenomenal Qigong instructor.
Oh, I
And
don't know about that.
well, I've only actually experienced your Qigong, so it's probably like really tough for me to find another Qigong class because I've enjoyed yours so much. And
Oh, that's good to
we
hear.
yeah, and we've been able to incorporate it into some of our workshops, which has been really fun. So now that so it sounds like you knew at such a young age that you wanted to focus on women's health and then incorporate Chinese medicine. I mean, there's hardly any 16-year-olds that I think that know that they want to go the natural medicine route.
Yeah.
So I think that's incredible that your heart and your passion came through so early on. And, being in our practice that's so heavily women's health, we see a lot of stress and hormone imbalances in the healing process for us. So I wanted to ask you a little bit more about what impact you find that stress, anxiety, and some of the mental, emotional components have to do with women's health and fertility.
Yeah, I would love to talk about that. I think that I'm actually gaining more and more appreciation for what a big role that's playing. First, I came into thinking about stress and emotional um, emotional distress and its relationship to health through a Chinese medicine lens. And in a lot of my work with groups, we talk about how chi or that functional energy, that vitality needs to move, and stagnation is one of the big causes of dis-ease.
Hmm.
And emotions are chi, and if they don't get to move, we literally create chi stagnation and can make ourselves unwell that way. So for a long time I sort of explained it that way and would use acupuncture and qigong and sometimes working with people's dreams and lifestyle things to help keep that chi moving. But in my deeper studies of functional medicine and the this evolution that what we could call Western or conventional or biomedicine is going through, we're really coming to understand how direct the connection is between stress and then hormonal imbalances. So I think many women are familiar with the idea that stress impacts fertility. And when
Hmm.
they come to us for acupuncture, especially if they're going through the IVF or some other assisted reproductive technology process, they come for help with that and for stress and anxiety relief. But I think there's not necessarily an understanding that of that beyond just oh, well, it would feel better to not be stressed out. And of course, it does feel a lot better to not be stressed out.
Right.
But it's very direct, the same, because the same part of our brain that signals the glands to make stress hormones, or we could think of them as survival hormones, when our system perceives that we're in a situation where our survival is at stake, we upregulate those stress and survival hormones, and we actually downregulate the hormones that we need
Mhm.
for healthy reproduction, for ovulation, or for a healthy uterine lining, and all of those things. So I think that coming to understand how many things can set us into a state of our system thinking survival is
Right.
at stake, which just the fertility process itself can trigger some of those responses. Um, Even feeling left out or excluded in a social situation or a family stress can trigger that. And then, of course, bigger, more maybe we could say primal sources of distress, like if there's any financial insecurity or your home doesn't feel safe, these
Mhm.
things really, really have a direct impact. So, turning to all the tools like acupuncture, and herbs and supplements, but a lot of it too is exploring how you can in your daily life make shifts that signal to your body, I'm safe, so that the priority can shift again.
Well, I think you said something really important because so much emphasis is placed on chi stagnation on a physical level.
Hmm.
And I think that the chi stagnation that can create some of the emotional stagnation or vice versa, where we have emotional imbalances that come up, then that creates a type of chi stagnation that affects us both on an emotional level as well as on a physical level is really
Yes.
important to bring up because I think there's so much emphasis on the physical manifestation of chi and blood stagnation. So
Right.
thank you for bringing that up because
Hmm.
it's so important. We know that the medications that are prescribed during an IVF cycle by themselves can create stagnation.
Yes.
And right.
Yep. Yep. The
So
medications and then the process can create that emotional stress. There's a lot
right.
going on there that we want to balance out. Yeah.
Can you share a little bit about how acupuncture and Chinese medicine can help relieve some of the stagnation and blocks that can occur in our body,
Yeah.
mind, and spirit? I'd love to hear your perspective on that.
Yeah. It's a interesting question to be asked. I mean, you probably get asked this all the time. What is acupuncture really doing? And
Yes.
I think I answer it differently every time,
Right?
depending on,
Totally.
what kind of information the person asking is looking for. But the way acupuncture works is by stimulating certain points on this whole landscape that is our bodies, right? And there can be stagnation in certain places on this landscape where it's like there's a some debris fell across the river and there's a dam and it's all backed up and the water's swirling, right? And we can do acupuncture right where that's happening. And energetically and in terms of blood circulation, it's like we cleared that dam and the circulation gets moving again. But then we can also use acupuncture more as a signaling system, like these points that so many people probably listening have had needled here in the webbing between the thumb and the first finger, or between the big toe and the second toe. Those points have an action of releasing blockages and encouraging chi to course more freely, and more fully and freely if it's been bound up and stuck. So acupuncture, in its unique way of using signaling, can clear some of those blockages. And then we have herbs that traditionally do the same thing, right? We have formulas that we work with that we know reliably over these centuries, millennia, really. When you have a woman who tends to feel irritable and teary and have swollen and tender breasts and have bloating in the week before her period, these herbs reliably get that chi moving. And we can feel it in her pulse when that changes, just like we can when we use acupuncture. Um, yeah, that's how I will explain it today. What do you think?
I love it. I think it's a great analogy about the water in the dam and like trying to release that dam so everything can flow freely. I always like to compare it to like a freeway with traffic jams and
Uh-huh.
accidents along the way,
Yep,
and our
yep.
body gets backed up. And so, our job as acupuncturists and Chinese medicine practitioners is to release those blocks so everything can flow freely
Yeah.
chi blood nutrients to nourish our bodies and nourish our tissues and our organs and, allow us to be the most optimal version of ourselves. So, but thank you for explaining that because I get that question quite a bit too. So,
Yeah.
exactly how does it work?
Right.
And
Right.
there's so many different systems in Western
Hmm.
medicine, I think, that are touched by acupuncture. Can you talk a little bit about that too and how it corresponds to the stress response and the endocrine system?
Yeah. So sometimes the language of Chinese medicine doesn't translate exactly to the thinking. It really doesn't. They're two different paradigms. It's like looking through two lenses at the same system, but they're different ways of describing anatomy and physiology. And sometimes you can translate, but sometimes you just have to put one lens down and pick up the other, I feel like.
Mhm. Right.
Um, but in terms of the Western anatomy and physiology systems, we have, I was mentioning the stress response, and that goes from the brain, the hypothalamus and the pituitary down to the adrenals. And then also in reproductive, you have the hypothalamus and pituitary talking to the ovaries.
Hmm.
And so acupuncture, we can tell has a direct effect on that. I know you've treated cases of hypothalamic amenorrhea many times as well. And when the lack of ovulation is primarily coming from a disruption there, usually that traces back to stress, we can use acupuncture to calm those parts of the part of the brain that's alarmed and stimulate the release of the reproductive hormones more. I mean, not directly. It's not like the needle stimulates the release of that, but it restores
Right.
the function. And then we have the more material, physical piece of the uterus herself and the uterine lining. And we can really use acupuncture to increase blood flow. So we see, since we're seeing so many IVF patients, we get direct feedback from imaging. The
Right.
ultrasound will confirm, oh, wow, this uterine lining is thicker. It has the healthy 3 layers. It's looking great for implantation. So we can affect blood flow that way. And then there's really no system that acupuncture can't support. We're depending on what any individual needs, right? We're working on her lungs if she's having asthma, her
Right.
digestive system. We know the gut is at the center of almost everything.
Hmm.
So, is that what you were asking? Am I
Yes,
getting
and
at?
and
Yeah.
I think I'm biased when I say we practice the coolest medicine ever.
I mean, I think it's the best.
Right. And being able to touch on the whole body and all of the systems
Yeah.
is pretty incredible.
Yeah.
I think one of the conversations I usually have with new patients is, there's like three or four areas that us as acupuncturists and Chinese medicine practitioners just automatically treat, and stress reduction is always one,
Yes.
digestive function is the other, sleep,
Yep.
like beyond that, and of course, fertility for our fertility patients, like you
Hmm.
never have to ask us to treat those things because we're always going to touch on those areas.
Yeah.
And then whatever else is presented at the time of your treatment can also be addressed in, our treatments for that day too.
Hmm.
So I
Hmm.
just love how we're able to offer that for patients where it's like, okay, this is the holistic umbrella we're always going to be treating. And then if there's anything else that you're coming in with that, maybe you have a headache today, or maybe,
Hmm.
you hurt your knee, or maybe you're breaking out in a rash for whatever reason,
Hmm.
we can also address those things too.
Yeah. Yeah.
So, yeah. So as far as functional medicine and Chinese medicine and the integration of the two are what we've been branding as functional TCM. Can you
Hmm.
talk a little bit about that and what that looks like for patients when they come in to see you?
Sure. Yeah. So I was thinking about your analogy of the freeway, and if that's how we look at blockage, and if we connect that to stress, I'm going to see if I can follow that thread here.
Okay. Love it.
So let's say that there is that stagnation, that lack of flow, right? Which we know can come from, maybe there's too much traffic, right? That's what we call an excess in Chinese medicine. There's too much of something and we need to lighten the load.
Hmm.
Or there could actually be not enough. There could be barely any cars on the freeway. although no one would probably ever complain there were too few cars. But theoretically, if there's supposed to be some traffic flow, there's too few, but there's been an accident or there's been some damage to the road. And so there's still that stagnation. So there might be injury or something that needs to be repaired. And I guess this part of the analogy doesn't bear out, but you can even have too few, too little of something, and that doesn't allow for the flow.
Hmm.
So if in Chinese medicine, when we're looking, that's one of the main questions we ask. What is there too much of that I can remove or lighten or move along, help it clear out? What is there not enough of that I can nourish? And those two questions I think about a lot in functional medicine as well. It's the same questions. But in Chinese medicine, I might be looking at, oh, the excess is there's too many cars. I have points and herbs that help clear that excess so that things can move again. In functional medicine, because that's really a holistic perspective that takes a person's whole life. I mean, Chinese medicine does this too, but your whole life into consideration. There might be an excess of blue light in your eyeballs at bedtime because you're on your screen, right?
Right.
And there might be an excess of working 16 hours a day. And like, what do we need
Mm.
to remove there? There also might be an excess of foods that are triggering inflammation. And we want to pull those out of the diet or at least minimize them in the diet. Deficiency in Chinese medicine, again, we can treat with acupuncture and with moxibustion, which is the heat therapy, and with herbs that tonify and build strength. And then in functional medicine, I'm asking, well, what do we need to add? And it might be lifestyle again, like a taking a break every 90 minutes where you actually just quietly breathe for 1 minute. No one will miss you for 1 minute, but it feels really like hard to do sometimes.
Right.
Or maybe you need to add a lot more vegetables, right? 5 or 6 cups of vegetables a day in every different color. For some people, that's a big, big change and like, but
Hmm.
makes a huge difference. You get all the phytochemicals, the antioxidants, the fiber that's so necessary for healthy hormones. So we might need to add in that way. Also, a lot of times in functional medicine, we're adding more supplements. So I might be adding magnesium or nutrients that specifically target whatever we're going for.
Hmm.
And so that's kind of the taking away and adding. And then as far as testing, staying with the stress theme, functional medicine gives us access to a lot more information
Hmm.
about the biochemistry, what's going on in the body in that way. So for stress, we can do something like a salivary test where you spit in little tubes at certain times throughout the day and we look and see what's happening to your cortisol. Is it rising nicely in the morning and you wake up rested and you're ready to go and then it just gently declines until bedtime when it goes to its lowest point, your melatonin goes up and you fall asleep easily and you stay asleep all night and then you wake up rested the next morning. If it's like that, amazing, congratulations. But a lot of times it's not
Yes.
like that.
Right.
You're in overdrive and we can see that the cortisol is staying high. And in that case, we target the herbs and supplements for that. You might be in total exhaustion where it's staying low or all kinds of other unusual patterns, that reflect whatever is disrupted. So, yeah, that extra diagnostic information from functional medicine can help us decide what to do. And then also we can check it again later and see what's improved, what hasn't, what do we need to reconsider.
Hmm. I love that. I love the integration of the two together because both of these models of medicine really look at the whole picture of a person and focus on the root cause of each condition.
Yeah.
So it's sounds to me like your treatments are very much geared at like fine tuning everything, right? Like
Hmm.
let's fine tune your diet so we can optimize your digestion, maybe reduce inflammation, and let's look at what other supplements that we need to add or nutrients that you might be deficient in. And
Hmm.
so it's so much like the yin yang balance, right? Of like,
Yeah.
deficiency and excess, right? Like let's make sure that the areas that we have excess, that we address that, and the areas that are deficient, we make sure we nourish and
Right.
tonify. So
Hmm.
it's such a perfect marriage of
It's
two,
really,
right?
they really work. you can talk about Chinese medicine through the language of functional medicine, like as a
Totally.
tool of functional medicine, but you can do the reverse as well. I mean, Chinese
Hmm.
medicine is such a thorough understanding of the human being. You can talk about functional medicine as a tool of Chinese medicine. It's like
Right.
they're both
Right.
such holistic approaches.
Well,
Yeah.
so how would you differentiate your practice versus a functional medicine provider, like a nutritionist or a physician that's practicing functional medicine, or even a naturopath?
I mean, partly it's personal style and personal tools,
Hmm.
right? Because in addition to having the whole, well, I'm not going to say the whole because Chinese medicine is vast, but I have many tools of Chinese medicine that I bring in. So that's a differentiation right there. To be able to look at someone's tongue and feel their pulse and diagnose in the traditional Chinese way. There's definitely been times that I've worked with people who've just gone down the road of functional medicine testing and haven't been able to get to the root of their concern. But then the diagnostics and the treatments of Chinese medicine do help them. So it's a very large toolbox to complement, like you've been saying, functional medicine. So there's that. And then also just my personal practice, I use craniosacral therapy
Hmm.
and dreamwork. So a person can bring me one of their dreams and we'll explore that usually while they're lying on the table with acupuncture and with acupuncture needles in, and then I'm doing the craniosacral and we're talking about their dream. And these bigger insights can come through, sometimes about health and fertility, sometimes about their life, their emotional, psychological
That
experiences.
sounds like the coolest epic treatment combination. So I just can you tell us a little bit more about craniosacral therapy and how
Sure.
you integrate it into your
Yeah.
acupuncture treatments?
So my craniosacral therapy education came through my martial arts and traditional Chinese body work and Qigong family lineage. So
Hmm.
it's connected with John Upledger's craniosacral system, but it's really, I
Nice.
have to say, more influenced by that like hands-on Qigong, hands-on energy work.
Hmm.
But with craniosacral, I'm still doing the what would be defined, as craniosacral therapy, which is a very light touch kind of body work. So rather than massaging points, I'm resting my hands on certain locations on the body and feeling for subtle rhythms and subtle motions that are happening in your organs and connective tissue in the plates of the skull and helping the body release restriction. So it's this really gentle way of tuning in and letting the body's attention, the innate healing intelligence that every body has, come to that place and release the restrictions and restore again that free flow. In this case, it's usually like an expansion and contraction kind of a rhythm. So craniosacral therapy is wonderful for head and neck things, spine things, but I also use it a lot when there's an emotional aspect to whatever's going on physically, which is almost all the time. And when there's a past really strong negative experience, whether it's a car accident or an emotional trauma that seems to still be being held in the body,
Hmm.
by following the body's lead in that really gentle way, those things can get released. Um, which sometimes looks dramatic, but usually it doesn't. A lot of times someone is very relaxed and falls asleep. It's not like necessarily a huge catharsis, but the body unwinds these long held patterns.
Hmm.
And it is indeed pretty epic when you combine dream work with craniosacral.
Yes, and so let's talk a little bit more about dream work
Yeah.
therapy and how that all ties in because everything just sounds like I mean the three together sound like the perfect trifecta treatment to, tap into your meridians and then the
Yeah.
craniosacral system and then dream work is like tell us more. What's
Yeah.
DreamWorks about?
I mean, I love dreams. I love dreams. I've been doing dream work now for about 13 years, and
Wow.
every single dream I've ever heard has been fascinating to me because you never hear the same dream twice. I mean, you hear certain repeated themes. People lose their
Hmm.
keys,
Right.
or their something is happening to one of their pets, or there's
Mm,
certain themes. People are being chased. You hear these themes again, but there's always a unique setting and storyline and characters, and all of those things have an energetic and a meaning. So the process of dream work, the way I do it, I mean, there's many ways to do it, but I ask a lot of questions and listen closely to what the connections are for the dreamer. And then if we're doing craniosacral at the same time, we can feel where that lives and moves in the body and follow that there and let those patterns shift however they're looking to shift. And I do offer what you might call interpretation, but I call it a projection in the tradition of my dreamwork teacher, Jeremy Taylor, which is I'm owning the fact that I'm just having an imagined version of your dream and an
mhm.
imagined version of your life, and I'm projecting on it based on my own identity and life and even my experience with dreams and even my intuition. I'm still like it's coming through me, right? So I'll say to someone, well, if this were my dream, this might relate to my sense of feeling really alone, but on some level, knowing that people who care about me have my back, right? Because the
Mm.
dream image shows me something like that. If it's true for the dreamer, they'll have what we call the aha moment, where just on some level, they'll be like, oh, yeah, that's it. That's true. But if it falls flat, then no problem. It's my projection. It's probably true for me, and we'll just keep exploring, right?
Right.
And so sometimes, uh, I want to say most times, something really important, really meaningful comes through. Every dream comes in the service of health and wholeness,
Hmm.
and it's never what we expect. If I'm not surprised, I'm like, I haven't done my job here because it's never what's right
You're
there on
like,
the
this
surface.
is too
This
practical.
is too easy. Like, where,
Yeah.
what did I
This is
miss?
too logical.
Yeah. Um, but if we stay with it, it's just beautiful what happens, and
Mm.
patients who are not particularly emotional, when they tear up because of a dream and they'll say, "Wow, that really got me." I hear that a lot. Like, but it's their dream. It came from the depths of themselves. So of course,
Yeah.
if we can reach back to the dream and make contact with what it really wants to say, it's gonna move you.
Okay. Everybody needs to sign up for that. Back to treatment.
Come on in. It's a good
Cranial,
time.
and dream work together. And so, kind of staying with the theme of stress, the stress fertility hormone connection,
Hmm.
how would you say some of these modalities of treatment can help support the nervous system and the reproductive system? What have you
Yeah.
seen in your experience?
Yeah. So I've seen that all the modalities we've been talking about are really helpful. And it's also important that we look at what's happening in someone's daily life to stop triggering the stress response dysregulation. So, what I've learned from my mentor in functional medicine, Aviva Ram, who's an MD and herbalist, she has taught really well about the four main things that trigger stress response dysregulation. Sometimes you hear the phrase adrenal fatigue, but it's not really that the adrenals get tired and like can't make cortisol anymore, but there's been so much wear and tear that the pituitary is no longer telling them to make cortisol. Or
Hmm.
you can have overactivation where you're in that state of a lot of demands on you, the stakes feel really high, and the pituitary is telling the adrenals make more and more and more and more. So chronic stress, like we've been talking about, from work or from life, or I
Hmm.
mean, just from being someone who pays attention and cares about what's happening in the world these days, it's chronic psychological stress.
Hmm.
Sometimes it's chronic physical stress, depending on lifestyle. So that's a big piece to address. And everything we've talked about, acupuncture, craniosacral, herbs, supplements, qigong, are a wonderful support for that. And the other big triggers, which would be circadian rhythm disruption. So
Hmm.
when you're going to sleep and when you're waking up, chronic inflammation, which can come from gut issues. Um, and what am I forgetting? Give me one second.
How about some of the autoimmune issues that might have originally stemmed potentially from
Yeah.
chronic inflammation and
And
chronic.
chronic stress. Yeah,
Mhm,
autoimmune does come more of a downstream effect, sometimes from chronic infection too.
mhm.
So with autoimmune disease, we're looking at addressing a lot of the same things, um,
Right.
with some additional concerns as well with autoimmunity. But I guess the main point is, looking at how you're running your days, what time you're going to bed
Mhm.
and what time you're getting up, and if you're taking breaks, and how your diet is impacting your level of inflammation. Again, supplements and herbs and acupuncture come in with healing the gut and reducing inflammation. Um, And then the other is blood sugar regulation.
Yes, blood
So
sugar,
a
right.
lot of variation in blood sugar going up and down all the time. That's
Mhm,
another thing that triggers the stress response system to think things are not safe. What is going on? It's not stable. And all of these things go both ways. So if you're under chronic stress, your one part of your body's asking for more blood sugar, right? And then you're getting more insulin as well, but then your insulin sensitivity goes down over time. So, since it goes both ways, all the modalities we've been talking about can treat some of all of that. But then lifestyle, how you're eating, when you're going to sleep, how you're winding down at night, also are really key to restoring a normal stress response. So, if we bring all of that in, and it may not be everything for every person, but if we bring in the parts that that individual needs, then we start seeing PMS symptoms
mhm,
dramatically reduced.
mhm.
The regularity of ovulation comes back, and sometimes ovulation just comes back. If a number of women have come to me in the last year who are not, shouldn't be by age going into menopause yet, they've been told maybe they're going into early menopause. For some reason, they've stopped ovulating. We address these things and they start cycling again. So you can pretty directly improve those hormonal and cycle parameters when you tackle the different factors of
Mhm.
stress.
Well, and it sounds like this would be really helpful for patients with PCOS
Yes.
issues since
Hmm.
insulin dysregulation and blood
Yeah.
sugar dysregulation is such a big part of
Hmm.
PCOS too.
Yeah.
So, well, thank you for sharing that and explaining those aspects. I think it's like when you think about hormones, it's so complex.
It's so
And
complex.
everything is so intertwined. You can't really pull it apart and just be like, "Oh, I'm just going to treat your adrenal hormones, by
Hmm.
itself," or "I'm just going to treat your thyroid
Right.
hormone." Like it's not that simple. Everything is tied in together, and one area of the body affects the other.
Hmm.
So I love that you pulled it all together. And functional medicine, I think, does a really good job of that and looking at
Yes.
the whole picture. And how do we optimize our endocrine system to the point where, we can have those things like the best sleep, the best gut health, have the energy that we want to have. And a lot of times patients come in and I feel like you probably hear this too. I just don't feel like myself anymore.
Hmm. Yeah.
Or if they're perimenopausal or postpartum, they're just dragging and like I don't have the energy to do anything. I come
Hmm.
home from work and I just want to go to bed.
Right.
That's something I hear a lot of. And
Yeah.
so I think that the tools that you mentioned are such a great way to sort of like reset the body and
Hmm.
get things recalibrated again. So, and like we say in Chinese medicine, there's an inherent self-healing mechanism within
Hmm.
each of us that can get thrown off kilter a little bit. And sometimes it just takes one of these tools
Right.
to get things back on track again, you know?
Yeah, and sometimes it's not overly complicated either.
Mm-hmm.
Like it can be very complex, and functional medicine testing is so helpful when it's complex.
Mm-hmm.
But if someone really has low thyroid function, and there's a particular trigger for that or way that we can support that, or if they go on thyroid medication if that's what's needed, suddenly everything is better, right? Sometimes there
Oh,
really is one primary issue, and there's a lot of hope, in just digging deep enough and looking widely and broadly enough to find what is the most root cause point we can find that will then
yes.
improve everything else.
Right. That's a great point. And that there is a way to get to the root,
Hmm.
and that you don't have to suffer through these feelings of imbalance.
Yeah.
Yeah. Okay. Well, thank you so much. Now, is there anything that you wanted to share with our listeners? Any words of wisdom or tips, health tips that you'd like to share?
I think I just want to add, we've been talking all about stress, and sometimes I see this actually cause more stress. And I don't want to be encouraging that. I just want to say to everyone who's listening to this and becoming aware, wow, I live way too high stress of a lifestyle, or I'm in these circumstances for my optimal well being, to hold that with a lot of compassion. We can hold compassion for you, and you can
Mm,
come along as you feel able. But really, self blame or feeling, on the other hand, like victimized, or all the stress that can come about the stress, is just adding more. Um, more reasons to feel like I need to survive this moment, right? And we
right.
want to send ourselves as many signals as we can of safety. So that
Yes.
compassion and just honestly doing whatever makes you feel safe and good and happy
Hmm.
is like a beautiful place to start with relieving some of the effects of stress. We are all doing the best we can.
Right.
It's not easy, and we're doing the best we can. And so I want this information to be empowering and encouraging to you, and not in any way create any sense of a burden or failure, because you're doing amazing.
I love that. Thank you, Leilani. That was beautiful words of wisdom. So now how can people find you and reach you? And you have your own podcast too. And I want
I
to make
do.
sure I mention your podcast
Thank you.
so people can tune in.
Well, the best way to find me for everything we've been talking about is here at Revive Chi Health and Fertility Center. You can come in person. I also do virtual visits if you're in the states of California or Utah. That's where I'm licensed. I can do virtual visits with you or in person here. And and my podcast is called Turning Season. It's a different theme. It's conversations with people playing all different kind of roles in our transition toward a more life honoring, life sustaining society. So all different types of conversations on regeneration and transformation on a social level, societal level. And I'm
Amazing.
looking forward to this fall, probably in September. Well, Dr. Yang and I will have more details on this, but doing a 3 to 4 week guided program where we address those different aspects of what it takes to restore a healthy stress response. Really simple, basic, doable steps you can take to restore health and balance there. So we'll share more info about that coming up.
That sounds perfect. May I ask, are you thinking this is going to be a virtual series or something in person? Or both?
I think it will be both, because I
Yay.
want this to be
Good.
available to folks who aren't here with us in Orange County. But so I'll have some audios that go out online. You can listen to them whenever, even if you do live here. We know how it is. So you can listen in your car or when you're doing your dishes or whatever. It'll just be little informational and then a practical tip kind of audios, bite size. And then we'll work in some kind of acupuncture and in person piece to it too for those who are local.
Amazing. I love that so much. Can't wait.
Yeah.
Well, thank you again, Leilani, for being on the Women's Health and Fertility podcast. And if there's anything else or any other questions patients have, you also offer a discovery call. Is that correct?
Yes, absolutely. Free 15-minute calls anytime. You can schedule that on our website, or the front desk is great at fitting those in throughout the week. So would be happy to talk with you if you have any questions.
Okay, wonderful.
Okay,
Thanks
thank you so
again.
much,
So
Dr.
grateful for
Yang.
you,
It's always wonderful to
Leilani.
talk with you. Thank you.
Likewise.